Okay, so we were talking about how we can dissociate two possible scenarios for the blindsided patient. One is for the patient to be adopting a very high threshold for saying yes. So that corresponds to this situation on the bottom left. Here, if the patient adopts a very high threshold, then it corresponds to the situation where patient does not say readily yes on this situation, and that corresponds to blindsided patients reporting no all the time, despite the fact that when they are forced to say either it was far or near, they could do it very accurately. So that's the one possible scenario that we can now test. And to test whether the patient is actually not seeing the stimulus or adopting a high criterion, what we can do is to change the frequency of the stimulation of the target presentation. And that's what they did in the second experiment. All right. So in this signal detection task, here experimenter asked patient to fixate at the fixation location here. And then when the patient is ready, they are asked to touch this part of the screen. And then that induces the brief presentation of stimulus in one of 5 locations here on the visible and good field, or this location, bad blind field here. And note that the majority of the trials, 60% plus 5%, are the trials where the one of the target is present in one location. And if it's presented in this good field, it was very low contrast. It's faintly seen, and subject needed to locate where it was located. On the other hand, when it was presented in the blind field, the contrast of the stimulus was relatively high, 30 or 46 or 99%. And the rest of the 35% of trials, they did not present anything. And subjects was allowed to press this button to indicate that there was no stimulus. No, I didn't see anything. Okay. And here is the result. So the first, when GY was presented with good FEM field, then in most cases, actually in all the trials, GY was able to detect stimulus 100% accuracy. And also when the stimulus was not presented at all, then GY also responded, no, I didn't see it, with 100% accuracy. So this is a correct rejection, and this is a correct hit in the signal detection terminology. And most interesting trials are the 5% of the trials where the high contrast stimulus at the lowest, it was 30%, 10 times stronger than 3% good field stimuli, or 46% stimulus. And in neither case, GY chose to press this button. No, I didn't see anything. And therefore the hit was 0%. On the other hand, when the blind field was presented with 99% stimulation, then he was able to say, sorry, he was able to say that, oh, I saw the stimulus. Again, 100% accuracy. All right, so in this GY's case, it is a case that when the stimulus is strongly enough, then he was able to report the presence, but if it's not, then he was not able to do that. All right, next. So they changed the frequency of the presentation to 20% of trials is catch trial. So they didn't say show anything. And then instead of 5%, they presented 20% of trials, these high contrast stimulus to the blind field. And then here is what they found. All right, so in these 20% of trials, most of the results were the same, except for this 46% trials, where finally GY responded to the presence of the target, roughly 10 to 20% of trials, but still 30% contrast stimulus was not reported, and 99% was the same. And the catch trial and also good field trial was responded in the same way, so it was not presented separately. And this contrasts strongly with the results of localization task. So the localization task was a task where GY was forced to choose whether the stimulus was in the near or far. And the detection task, he was given option of not seeing the stimulus. Okay, so that's the huge difference between detection task versus localization task. In the localization task, the chance performance was again 50% trial, 50%, and GY was able to accurately discriminate the location at 80% accuracy when the contrast was 46%. However, in roughly 20% of the trials, GY reported only 20%, so 80% of or so, GY reported not seeing the stimulus. And the proportion is slightly different for from the left, detection task, and that's the nature of the report of the visibility. In the localization task, this number refers to the report of the visibility of the stimulus in some form based on the verbal report. On the other hand, here, the report of not seeing is by the intentional choice of stimulus absent bottom. And that made a slight difference between these. Okay, so what does this all mean? According to the behavior observation, it's safe to say that these patients and monkeys navigate through the world by visually recognizing the object, and that's demonstrated by the videos. And then a localization task where the position of the stimulus was forced to be chosen, they can perform the task very well. And in the case of monkey, he was able to pick the food very accurately. Phenomenological report-wise, or when given a third option of not seeing the stimulus, patients as well as monkey, which I didn't explain today, basically reported total loss of vision. In a signal detection task, they chose to report not seeing the task, regardless of the frequency of the target stimulus in the blind field. And one possible way to explain all these results could be that they are lying. And however, if that's not the case, which is the most likely scenario based on the many different kind of experiments since then, how can we explain these phenomena? That's the next question. So in next week, I will provide one potential way to dissociate these two, to reconcile this situation by combining the signal detection theory together with a confidence rating. It's a little bit of a methodological kind of a lecture part. And then the second, we want to understand how it's possible that this kind of blind sight situation, dissociation between localization and detection is possible. And to explain that, we need a deeper dive into the visual system. And I will explain the basics of the visual system from eye to primary visual cortex or V1. All right, see you next week. Bye.